Hey, welcome to Right Focus Healthcare LLC educational channel for primary care nurse practitioners. Today we are going to do a video of Trelegy versus Breztri. As we all know, those are inhalers used in respiratory medications in asthma or COPD. And we often see patients in clinics who are on these medications even before they've been started on other inhalers. So as clinical providers or primary care providers, we can recognize that pattern and reduce unnecessary early use and making sure these medications are given only when absolutely needed or follow the step-up therapy or after referral for pulmonary function testing or specialist or pulmonologist evaluations. In this video, we can learn about their indications, their components, the conditions where they are approved, and the benefits and the risk of using them, especially the risk and the benefit if started them early. Next, indications of Trelegy and Breztri. Trelegy Ellipta is approved for maintenance treatment of COPD and also for asthma. For details about COPD and asthma, pathophysiology, definition, treatment, all there are videos in this channel. Please refer to it. And Breztri Aerosphere is approved for maintenance treatment of COPD and is not yet approved for asthma. Now let us discuss the components of Trelegy and Breztri. Both of them have the same components, ICS, LAMA and LABA. In Trelegy for COPD maintenance, 100 microgram ICS, 62.5 microgram LAMA and 25 microgram LABA per inhalation once daily. For asthma, we can use the same 162.5, 25 microgram or titrate up to 200 microgram, 62.5 and 25 once daily as the maximum recommended strength. In detail, in Trelegy, the inhaled corticosteroid fluticasone furoate reduces the airway inflammation, and the long-acting muscarinic antagonist or LAMA, umeclidinium, relaxes the airway smooth muscle, and the LABA or the long-acting beta-2 agonist vilandrol do the bronchodilation. Next, about Breztri, each inhalation delivers 160 microgram ICS, 9 microgram LAMA and 4.8 microgram LABA. The typical dose is 2 inhalation or puffs twice daily for COPD maintenance. So total daily dose is 320, 18 and 9.6. You can note here that compared to Trelegy, the ICS dose is about 3 times. What is the easy way to remember Trelegy versus Breztri frequency? Trelegy is a disc inhaler, so it's usually once daily. And Breztri is a MDI spray inhaler, so the dosage or frequency would be 2 puff twice daily. Just before we go to the advantages next screen, just do a quick review. In asthma, we step up from low-dose inhaled corticosteroids to combination ICS LABA for moderate disease and add a LAMA or triple therapy in severe or uncontrolled cases. For COPD, according to the gold staging, the mild cases we start with one bronchodilator, and then for moderate with a LAMA plus LABA or LABA plus ICS, and triple therapy like Trelegy or Breztri is for patients in group E or gold stage 3 and above who have frequent flares. If you want to learn more about these steps in detail, please check out the videos of asthma and COPD treatment in this channel. Next, advantages of triple therapy like Breztri or Trelegy. Number one, adherence. Patients are more likely to take an inhaler if it is one inhaler and simple and effective. And control of airway inflammation. Controlling inflammation help relieve airway obstructions and relieve shortness of breath. And reduces the frequency of COPD exacerbation, which can prevent a hospitalization and improve the quality of life. And this improves the lung function, which we can test by the pulmonary function test. And for those patients who are on persistent symptoms on dual therapy like ICS plus LABA or LABA plus LAMA, or stepping up will help them symptomatic relief and help patients maintain better respiratory capacity. Next is the disadvantages of triple inhaler therapy. The inhaled steroid component in Trelegy or Breztri can cause local side effects such as oral thrush, hoarseness, or cough, or pneumonia risk. And systemic steroid effects are rare, usually at usual doses, but we still need to monitor patients. Other considerations include the patients get accustomed to higher doses, higher cost, multiple drug exposure, and the risk of overtreatment if medications are not weaned off properly. And this is very important for nurse practitioners or primary care providers to remember when we initiate the triple therapy. Any patients must be on some single inhalers or dual therapy like ICS plus LABA or LABA plus LAMA or simple LAMA. So the patients currently, whatever the inhaler is using, we should be discontinuing that before starting triple therapy. This prevents duplicate dosing and unnecessary side effects. Next is about what I spoke in the introduction, the benefits and risk of starting early triple therapy. The advantages include rapid symptom control in asthma and COPD, and then prevent hospitalization in high-risk COPD patients, especially those with frequent exacerbations, and then simplifying the regimen because there is only one inhaler which can improve adherence. Next, about disadvantages, Trelegy or Breztri, which include in the triple therapy, is not recommended as first-line therapy in most guidelines, which, as we know, the latest gold guideline, we should start with a bronchodilator, LABA or LAMA, and then go to dual therapy, which is LABA plus ICS or LABA plus LAMA, which then we go to triple therapy. Number 2, there is unnecessary exposure to inhaled corticosteroids for many patients, which can increase side effects. Number 3, patient may find it harder to wean down from triple therapy once started, and some of the patients are accustomed to higher doses, making dose adjustment or stepping down more challenging. Then 4, increases the cost and the risk of side effects, particularly in patients with a mild disease who may do well on less intensive therapy. They may not need all 3 inhalers. I'm concluding this educational video here. So far we discussed Trelegy versus Breztri, their indications, components, and the benefits and the risk of using them, including when started early. Also, we learned that providers have to be very careful in discontinuing other inhalers like mono or dual therapy prior to starting on triple therapy like Trelegy or Breztri. And I hope this video will add to your clinical knowledge. Please don't forget to subscribe to the channel. Thank you for watching.